Hi, my name is Courtney Foght, and I did my research project on motivational interviewing and the impact on addiction treatment, a case study. My internship is at Hazelden Betty Ford Foundation, which is primarily a substance abuse and addiction treatment facility. And motivational interviewing is an intervention that we utilize pretty much every day there when working with clients. We use this both within group sessions as well as individual sessions as well. My presentation is going to discuss a little bit more about motivational interviewing and what that is exactly, as well as the population that this can be demonstrated on, including which population I used my intervention on. I'll also go ahead and talk about how I implemented the intervention, as well as how I evaluated that this intervention did or did not work, as well as talking about the results of those assessments. So, going into what is motivational interviewing, like I mentioned, it is a therapeutic intervention used to address addiction and substance use disorders. It strengthens someone's motivation and commitment to a particular goal. With this case, that would be sobriety. It does pull from various therapeutic styles and theories, such as humanistic cognitive dissonance theory, therapeutic relationship building, stages of change models, and also positive psychology. This intervention was developed originally to be brief and aimed at increasing motivation for change in problem drinkers. However, over the past about 3 decades, motivational interviewing has expanded to the treatment of other populations and has a ton of empirical support for treating people with drug, gambling, smoking, health, and a variety of other problems as well. So it does include techniques such as reflections, open questions, developing discrepancies, rolling with resistance, feedback, developing a change plan, engaging ambivalence, and supporting self-efficacy. Together, really the client and the therapist or the interviewer, if you'd like to call them that, uses reasons for change directed by the client to address ambivalence and then turn the desired goal of sobriety into a reality. So, like I mentioned, this is effective for problem drinkers, substance misusers, and people who just all around demonstrate resistance to changing problematic behavior or behaviors. Severity of the problem, gender, and age do not affect treatment outcomes. So, that is one thing to note. Um, this intervention does not work best for young children or cognitively impaired individuals because of the necessary higher order mental functioning demands that this requires. So, for the purpose of this study, I decided to focus on one case in particular, and this was a 33-year-old heterosexual Caucasian female diagnosed with alcohol use disorder, severe dependence. And also, another important thing to know is that a client receiving motivational interviewing can be any race or gender, and they can also be at any point in their recovery. So, coming into recovery, just being a week sober, or maybe even a few months sober. So, just at any point, they are able to come in and receive this kind of intervention. Sometimes, too, they can still be at that maybe pre-contemplation stage of change where they don't even think they have a problem at all. This works well for that also. For the intervention plan, so in order to implement motivational interviewing, I first had to build a therapeutic relationship, which is something that is done even outside of motivational interviewing, but that is really the first foundation step in implementing this, just building that alliance between myself and the client through really engaging and being a active listener. Then I did focus on maintaining a specific direction in change talk. So, just assessing where they were within their stages of change and trying to maybe reframe the way that they were talking about change and kind of redirecting in that sense. Next, I elicited the client's own motivations for change through evoking. And then finally, I developed a commitment to change with the client and established a plan of action. In order for me to evaluate and monitor progress of motivational interviewing, I utilized 3 feedback informed treatment assessments. So these are assessments that Hazelden provides to clients through their online client portal. So as a therapist or counselor in training there, I am able to select the assessments that I would like the patient to complete on their own time. So I did make sure to send these 3 assessments out to the client before I had implemented motivational interviewing, and then I did follow up once we had our session where I was able to implement the intervention and take a look at her results afterwards. So I was able to establish a baseline and kind of see where she was at before motivational interviewing was used. So the 3 assessments that I used were the brief addiction monitor, commitment to sobriety scale, and desire for substances questionnaire. So the brief addiction monitor, it is a 23-item assessment, and it also includes subscales. So this assesses whether or not a client has recently used a substance, assesses their risk factors and their protective factors as well. For the commitment to sobriety scale, this is a 5-item scale that assesses the client's level of commitment to their sobriety. So pretty straightforward. And the desire for substances questionnaire, the DSQ, this assesses for the level of cravings of substances and contains 2 subscales, which are desire and intention, and then negative reinforcement. The reason I chose these 3 assessments, Hazelden does kind of have our list already that we can, different assessments that we can provide to clients. And I just thought that these really made the most sense as far as establishing stages of change for the client. So that was the reason why I chose all these. And it was, it is pretty convenient that these are assessments that are already implemented into Hazelden's documentation and system. So it's just very readily available for myself to send and for the clients to receive. So it's not asking, to take up time during sessions or, the time that they're on site at Hazelden during treatment and programming. So for the client's result on the assessments, first, I'm going to go over the scores for the BAM. So this is the Brief Addiction Monitor. And this assessment, again, has 3 subscales, and they are substance use, which is the blue graph. Risk factors are the greenish yellow, and then the protective factors are orange here. So as you can see, she scored a 1 for substance use, and after motivational interviewing, she scored a 0. So for 1 on substance use, basically what that means is that the client did use a substance for 1 to 3 days within the last 30 days. And automatically, any kind of score on that substance use subscale automatically is a what we call red zone score. So that's something that when we see going through the documentation and the assessment that we definitely want to address whenever we see the client again. So that's something we want to bring up in group or something that we need to bring up in the individual session, because that means that the client did use. And anything that is below a 1 is considered a yellow or green score, which is something that's preferred anytime that the client is moving away from the yellow or the green more toward the red in their scores. We definitely want to address. So with the risk factors, the client scored a 12 initially, and then she scored a 10 after motivational interviewing was implemented. So for that subscale, anything above an 11 is actually in the red score. So that was something that we needed to address because her risk factor score was so high. Afterwards, the score was dropped to a 10. So the 10 score for that subscale risk factors is within the green zone. So you can really tell that motivational interviewing did have an impact there because she went from a red score to a green score. For protective factors, a 5 is considered to be in the red zone, and then it went up to 9, and that's considered a yellow zone score. So she did go from the red zone to a yellow zone, which are results and scores that we want to see and what is preferred. So if we are, moving again more from the red or yellow scores to, or I'm sorry, the green yellow scores to red, then that's really something we need to be addressing in the sessions with the client, because they may be answering these assessments more honestly than when we're seeing them face to face. And that could be due to a multiple reasons, really, but a lot of shame is involved in that. For the commitment to sobriety scale, again, this is just the motivation. This one is pretty straightforward. So she originally scored a 20, which is a yellow zone score. And then it went up to 30, and that is a green zone score. So motivational interviewing really had an impact on this patient's motivation, for a lack of a better term. So you can really see that the intervention had a pretty substantial impact on both the brief addiction monitor and the commitment to sobriety scale. And now we are going to discuss the desire for substances questionnaire results. DSQ, so desire to use substances questionnaire. For this one, for their desire or intention, she originally started out with a 3. And so a 3 is a little bit in the yellow scores. So that's just something, we want to keep an eye on. It's not a red score though. Red score is where we really need to address those scores and if they're having an issue with that. Because they're able to do these assessments on their own, sometimes it is more likely for them to be honest in answering these assessments rather than addressing them in the session or being honest in the session. So you can see that it went from 3 to 1, and 1 is a score that is located in the green zone. So that is, again, where we prefer the client to score. For negative reinforcement, it actually did not change. So she scored a 1 to begin with, and then after motivational interviewing, it was still a 1, and a 1 score is within the green score. So again, just something that we would need to be mindful of if it did go up for any reason at all. So as you can see from these 3 assessments, motivational interviewing did have an impact on all 3 of them. Maybe not so much on the negative reinforcement for the desire to use substances questionnaire. However, it did have a substantial impact on the commitment to sobriety, the motivation, as well as using substances. And then the risk factors decreased and protective factors increased. And these are my references. And that is the end. So if anyone has any questions, I can now address those here if there are any. Thank you so much.